So good day everyone, I'm Marian Imbarba and now I'm going to perform the proper procedure of perineal care and catheter care for the purpose of avoid the spreading of microorganisms, then to give the patients a comfort and relaxations, and to avoid the patients from the foul smell or undesirable smell, then to give the patients a fast healing or recovery to her lacerations. And before doing the right procedure of perineal care and catheter care, make sure to follow the 12 sequence. So first, before going to the patient's room, make sure to read the patient's chart, diagnosis, and know the patient's status, as well as read doctor's order. So now we're going to proceed to the patient's room, then knock the door and introduce yourself or greet the patient. So, good morning ma'am, I'm Arian Imbarba and I'm your caregiver for today, 7 to 3 p.m. and I'm going to clean your perineum area for the purpose of giving you a comfort and relaxations, and to give you the fast healing of your lacerations, then to avoid desirable smell or foul smell, and to prevent you from the spreading of microorganisms. It is okay for you, ma'am? So, ma'am, may I know your name, ma'am? Okay. When's your birthday, ma'am?
November 14.
Okay. So, it's okay to you, ma'am. So, now, ma'am, I'm going to check your temperatures or vital signs. Okay, so, ma'am, your vital signs and temperature is normal. And, ma'am, can I ask permissions to go out and go to the stations and prepare all the materials and tools needed for our perineum care? Okay. Thank you, ma'am. So, before leaving to the patient's room, make sure to lock the side rail as well as the wheels, and to prevent any form of accidents or injuries from the patients. So, while at the station, don't forget to put a warm water to the bedpan so that the patient will feel comfortable. Then, after the bedpan warm through the water, then set aside the bedpan and prepare all the materials needed, and wear PPE, gloves, and also wash your hands properly using the hand washing technique. So after preparing the materials and tools needed, go to the patient's room and knock the door. So, hello ma'am, I'm back. And do you want to depict a photo? So, I'm going to start.
So make sure to provide patient's privacy.
So now we're going to make a diagonal. So place the edge of the top sheet, the center of the patient, and another edge. So do it like this. And then, we're going to bend the knees of the patient. So, bend the knees while leg apart or dorsal recumbent position. So, after positioning the patients to a dorsal recumbent position, expose the perineum area and wrap the leg. Now we're going to put a bedpan under the buttocks of the patient. Let the patient. So after putting the bedpan under the buttocks of the patient, put a towel, roll towel so that the height will be balanced. So let the patient, and also put a towel to the over the top sheet, then wrap it to avoid the linen from getting soiled and wet. Now we're going to rinse the perineum area using the lukewarm water. So we're going to rinse first the mons pubis. So mons pubis, then pardis labia majora to the nearest labia majora, pardis labia minora to the nearest labia minora, and then to the center. So clitoris, urethra, vagina, anus. Then to the pardis groin, and to the nearest groin, then to the pardis inner thigh, then to the nearest inner thigh. So now we're going to clean the perineum area applying the 7 strokes. So we're going to first clean the nearest mons pubis down to the pardis labia majora, then to the other side pardis mons pubis to the nearest labia majora, then wash, rinse, then to the pardis labia minora, and to the other side nearest labia minora, then wash, rinse, then to the pardis groin, singular stroke, then the other side nearest groin, singular stroke, and then wash, rinse, and to the pardis inner thigh using zigzag stroke, then to the nearest inner thigh other side zigzag stroke, then wash, rinse. So now we're going to rinse the perineum area, so using the lukewarm water. So first we're going to rinse the mons pubis, then down to the pardis labia majora and to the nearest labia majora, and then to the pardis labia minora and to the nearest labia minora, then to the groin and inner thigh, then to the nearest groin and inner thigh, and then to the center, clitoris, urethra, vagina, then to the anus and buttocks. So now we're going to clean the center. So we're going to clean it with a sterile process. So now we're going to change our gloves with a sterile gloves and do the materials or prepare the materials. So now we're going to put an extra towel to the top of the mattress so that the mattress will avoid from getting soiled and wet. Then put the tray which is the materials is being sterile. So after that, use the forceps to get cotton balls. Then always remember to wrong side out the top of the cotton balls. So get at least 5, or before that rinse the forceps to the sterile water and then get at least 5 cotton balls. Then put it to the sterile kidney basin. So now my hands is already sterile because I've changed sterile gloves, and now I'm going to pick cotton balls to the non-working or non-dominant hand. So I'm going to pick cotton balls and then transfer to the dominant or working hand. So I'm going to clean the clitoris down to the urethra, then down to the vagina, then discard it. Then another cotton balls pick, then transfer, then clitoris down to the urethra and vagina, then discard. So we're going to pick again, then transfer, and going to clean the clitoris, urethra, vagina, then last anus and the buttocks, then discard. So using a tissue, damp or pat dry the perineum area of the patient. So Then, start from the mons pubis. Zigzag stroke to up. Then, to the pardes, other side, to the pardes labia majora. Then, to the other side, nearest labia majora. And then, to the pardes labia minora. Then, to the other side, nearest labia minora. And to the groin with a singular stroke. Then, to the nearest groin, singular stroke. And then, to the pardes inner thigh with a zigzag stroke. And to the other side, nearest inner thigh with a zigzag stroke. Then discard. So after patting dry the mons pubis, then the majora and minora, then the groin and the inner thigh, let's going to pat dry the center using the another tissues and with a singular stroke. So starting at the clitoris, urethra, vagina, then anus and the buttocks. So discard. So now let's proceed in cleaning the catheter. So first we're going to change our gloves with sterile gloves again. Then get at least 5 cotton balls using the forceps. So first rinse the forceps to the sterile water. Then get at least 5 cotton balls. Then after picking up 5 cotton balls, pour a small amount of betadine to the sterile kidney basin. And then pick at 2 cotton balls. Then 1 cotton balls hold the catheter, and the other do the rotary or circular motion at least 2/3. Then discard. Then pick again. Then do the rotary or circular motion at least 2/3, and then discard. So after cleaning the catheter, dispose all the unwanted materials and clean the area. So after disposing the materials, then cover the perineum area of the patient. Then back to the spine position. Then cover, and now the patient is comfortable and fresh.